All right, so I'm gonna go back to the same, like the first module, verifying clinician's order. On this one, you see like it says check the type of study order, confirming physician's credential, and validating patient information, and reviewing insurance and pre-authorization, ensuring order, ensuring the order matches clinical symptoms. Okay, so here we have to do 1, 2, 3, 4, 5. And where do we find this one? We find in the referral page, in this referral page. So first one, we check all patient date of birth, address, date of birth, everything over here, you know. And after that we check testing like what kind of test. So normally the doctor will mark it, we don't have to do it, doctor will mark it. So if the doctor tick marked like the first one 95810, that means the doctor has ordered polysomnography PSC study. If the second one is marked, that is the CPAP or BiPAP study. Third one is marked, that means this is for the multiple sleep latency test. So it says that the symptoms, you see symptoms, witnessed apnea. Apnea is something, apnea means people hold their breath. When they hold their breath, that syndrome is called apnea. So witnessed apnea, that means the patient will tell the doctor, yeah, somebody told me, my wife told me that I hold my breath. That is witnessed apnea. Choking, gasping, or snorting. That means when patient sleeps at night, feels like choking, feels like gasping, and is not able to breathe good, or snorting like that. That's the snorting. Is snoring, is snorting. So the next one is nocturia. Nocturia is something like patient use the bathroom at night. They go to the bathroom 2 to 3 times every night. That's called nocturia. Next, it calls snoring. You know, the snoring is like snoring, yeah, making noise. Okay, morning headaches. The patient may have morning headaches, difficulty initiating sleep, that difficulty falling asleep, teeth grinding, that is called bruxism. I mean, some patient, they grind their teeth when they sleep at night. Dyspnea. Okay, I'm just trying to see like if I'm thinking correct or not. So yeah, okay, I mean dyspnea is something like having difficulty breathing. Okay, having difficulty breathing. Restless leg syndrome, kicking the leg and having like itching sensation on the leg. So next thing is dry mouth, non-restorative sleep. Patient do not feel rested. Patient always get tired. So these are the symptoms of the people who have sleep apnea. But people who have sleep apnea, they may have medical problems too. And that causes like heart failure. You see, if somebody has heart failure, diabetes, obesity, hypertension, COPD. COPD is difficulty breathing. When somebody smokes for many years, his lungs get dried out and cannot hold enough oxygen. At that time, patient breathes really fast, like that, and patient is not able to, breathe well. Cannot handle enough oxygen in their lungs. That's why they have to breathe fast. That kind of problem is called COPD. Epilepsy, epilepsy. Epilepsy is also type of medical and mental like central nervous system kind of problem. Asthma, asthma is like breathing problem. Hypoxemia is like difficulty, like lack of oxygen. So, and after that we have to check ordering physician's name, address, and signature. We have to make sure there's a signature. Okay.
Whose signatures?
Physician.
So this is a physician part.
Yeah, this is the order, sleep study order. This this form is doctor's order. Doctor's sleep study order. So when you get this, when you go to your office for the work, first thing you have to check your patient, their date of birth and everything. Second, you have to check what kind of studies ordered. Third, make sure you check his symptoms. Oh, patient is choking, feel like choking or gasping. Patient is grinding his teeth. Like, this is the symptoms that you need to know. Then you can check like comorbidities. This is called comorbidities. Comorbidities means because of sleep apnea, people have like consequences, problems because of sleep apnea. They may have heart failure, they may have diabetes, they may have obesity, hypertension, COPD, epilepsy, asthma, hypoxemia. These are if somebody has this, then most likely you can tell this patient may have sleep apnea. Okay? And then third one, you have to check the physician's order. Okay. So in that way, we have to check everything. Like number 2, testing and indication, obstructive sleep apnea symptoms, central apnea symptoms, narcolepsy symptoms, insomnia with suspected sleep disorder, restless legs syndrome, periodic limb movement syndrome, parasomnia, chronic fatigue, or daytime sleepiness. Okay. These are like what kind of problems patient have. Like normally, these are the assumption. Like obstructive sleep apnea means people stop breathing. If you check on the side, it says loud snoring. Witnessed apnea. Witnessed apnea means somebody has seen that patient hold his breath. Witnessed apnea, gasping for breath during the sleep, very difficult sleeping, excessive daytime sleepiness, or morning headaches. Central apnea. Okay, central apnea is different. But we will come. This is just the general information you need to know. But later we will go in detail about this thing. Okay, we'll do detailed study about this thing. And it says like why verification is matter. Because ensure patient safety. To ensure the patient safety, avoid unnecessary testing. Sometimes we think the doctor has ordered PSG 95810 and technician does 95811. That's no good. That may be a free study. That may be a not good study because you're supposed to run the exact study that doctor has ordered you. So those kind of things to find out the patient's safety, because sometimes if somebody has a wrong study, then this may be not safe for the patient. Number 2, improves test accuracy. So when we do all checking, then it helps us to accurately run the report, run the sleep test. Number 3, insurance approval. And we need to check, like, let's say the doctor has ordered for 95810 PSG, and its CPT code is approved for 95811 sleep apnea. Like that's a CPAP titration. Then you cannot do the wrong study. If your doctor order has like 95810, you have to run 95810. Doctor will clearly tell you about those. Okay. And next is also need to find out insurance approval, if the insurance has been approved or not. And because if the insurance is not approved, we still run the study, we are not going to get paid. So it's a very important insurance has approved it. And I'll show you later like how we can track all this thing. Next is misdiagnosis of delayed treatment. Uh, it means it prevents misdiagnostics or delayed treatment. Sometimes what happens is we do one study, doctor has ordered another study. That is the misdiagnosis. Sometimes when we do that, then treatment will be delayed because again we have to repeat the right study and we have to follow the treatment study. So those kind of things we have to do. So if you go down, I have listed out easily bullet points that will help you to study. Okay, number one, it says like section 1, patient information, patient name, date of birth, patient ID, chart number, scheduled date of study, referring physician, ordering physician. We have to check this. Then we have to check like clinician's orders verification. You verified polysonography, CPAP, BiPAP, split test, MSLT, like what kind of test. Third thing is special instruction, oxygen therapy, PAP pressure setting, medication to hold or administer, other. That means when we do the sleep study, before that we have to check all this thing. If there is oxygen is given, oxygen needed or not, like those kind of thing, you know. Sometimes some people may need oxygen. Okay. And so those kind of thing, relevant medical condition, hypertension, diabetes, heart disease, COPD, neurological disorder, and pre-test confirmation. Like we have to confirm this thing. Okay, this is kind of like. Okay. Yeah. Hello. I'm. म क्लासमा छु ल. Okay. म क्लासमा छु. Okay. Now, so in this way we have to know, like, you know, every time we study about this, it's gonna repeat. It's gonna repeat. Same kind of symptoms, same kind of thing is going to repeat. Okay. Now next is history and physical. Can you check on the history and physical? Click on that on your canvas.
History?
History and physical. Okay. On your module, domain 1, and if you go down, task A, review patient information and perform clinical assessment, and we went down. Did you see here?
I saw medical history.
History and physical, right? Okay.
So, yeah, testing indication and medical history, pre-test confirmation.
Hold on. Okay. You go to module. Go to module. Start over. Okay. So polysonography, CPSCT prep.
Medical history. testing and injection.
Okay, this is the beginning, right? This is the beginning.
Yes.
And click on the polysomnography CPSCT prep. And
Mm-hmm.
this is our domain 1. Look, domain 1, domain 2, domain 3, and this, right? Click on domain 1.
Yeah, domain one.
Okay, right below domain 1 there is a task A, review
Tax
patient
A.
information and perform clinical assessment.
Oh,
And below
history.
that, yeah, history and physical.
Yes. And
We finished verifying clinician's order, and now we are going to click on the next one. Okay,
common
did you see that? Okay.
common questions.
Oh yeah, it says like common questions typed in history and physical.
Mm-hmm.
Okay. What I did is like if there is a document, can you click on that document at the top and you will get this form. You can print this one out too.
Sure.
This is patient information. So go through this. If patient registration, you see all kind of information, and this is the one. Like you have to go through this. Okay. So next week, just go through this, read it out, and study this questionnaire and everything. Then we will start. We will study this one.
Sure.
Okay. So, do you have any question about today's study class?
Uh, yeah, I
So,
have the
which one?
like the code. You know the
Code.
code.
Okay. Yeah.
Yeah, the code number.
Uh huh.
I saw here like 810 811 second 811 so 805.
Mm-hmm.
So how could we identify which is the same number?
Yeah. So what happens is like 95810 is the basic standard test polysomnography, right?
Mhm.
95811 is using the mask. Okay, that's the treatment level of test. Okay, so first of all you have to understand 811 means using the CPAP mask. All right, now if you go to the next one, 895811, split night. So this is a different types of test. It is combination of 810 and 811. So normally what happens is when people come for standard test, when people come for 95810, sometimes they are so severe. Sometimes they are so severe. From the middle of the night, we may have to put him on the mask. We do treatment and the standard and the treatment together. That test is called split night test. Because we use the mask on the split night test, that's why it is we can charge at 95811. Okay. Polysomnography standard test without mask. Doing the hookup, and we ran the study all night, no mask. Number 2, 95811. When patient come for the second study, sleep study, we start with the mask on. Okay, we give them mask, start the study. But sometimes some patient come for 95810 standard test, but they are very severe. We see like they stop breathing for 40 times in 1 hour. In that case, our lab, according to our lab protocol, we can start titration 95811. So we charge for 95811. Okay? Yeah, I mean, this all it makes sense when you go do the practical, but we will slowly we will come over there. Now the next one is 95815 home sleep multiple sleep latency. This is called multiple sleep latency. This is the type of test where patients are like, we let them sleep 5 different naps, we let them sleep. We wanted to check like how fast somebody can sleep. This test is called multiple sleep latency test, means how fast a patient can sleep. But the other one, 805, maintenance of awakefulness, that means that's a different type of test. That test is like we check how long patient can be awake. This one, MSLT, we check like how fast can patients sleep. Multiple awakeness, MWT, we wanted to check like how long patient can be awake. Does make sense? Little? Okay. Yeah, this MSLT is the test for people who have narcolepsy. They always fall asleep, and we don't know why he's sleeping. He slept 10 hours but is still not feeling rested, always sleeping like this. So for that kind of test, we have to do one kind of test called narcolepsy. And on that narcolepsy, we let patients sleep and check like how fast patient can sleep. Okay, normally patient takes about 90 minutes to 2 hours to go to REM, deepest sleep. But patient who have narcolepsy, they can sleep in 1 minute, and in second minute they can go to REM. That's not good. Okay, that's not good. So this is a sleep problem. Narcolepsy is a sleep problem. And to indicate the narcolepsy test, we do this MSLT test. And the other side, MWT, maintenance of wakefulness test, we wanted to see like how long patient can be awake. So this is for the flight attendants, like pilots who fly the airplane. They have to be awake. They cannot sleep. So some people, they fly but they fall asleep. They sleep for 10 hours but they fall asleep. In that case, we do this MWT test, and we ask them, don't sleep, look on the screen and be like this, and they will stay like this, and after 10 minutes, 15 minutes, they start falling asleep. So we count like how long it took them to fall asleep. So this is the type of test, and you will understand when you do your practical thing, hands-on. At that time you'll understand this test. But we will go more detail. You certainly, because that's why like I normally don't want it to go domain 1 like this, no domain 2, but I wanted to go the different types of sleep problems, sleep test, and then we come back to this domain 1. Anyway, next week what you do, study about, check those history and practical, all those questionnaire, check it out, study, and practice this verification also, okay?
Sure,
Domain
sure.
1 and 2. All right, and on the side, let me see if there's calendar. Okay. Okay, on the top, you see here at the top, there's a calendar.
Mm-hmm.
This calendar tells you like what is going to be the next week also. Like, did you click that calendar?
Yes.
So when you click the calendar, it says like today 1020 measurement in real head by instructor.
Mm-hmm.
So we did that, and next week if we go on 24, it tells you verify clinician's order and testing indication. And Tuesday it says like task B polysonography, equipment and supplies. So in that way, what we're going to study every week, it comes over here. So you can check over here what's going to come. Okay. Okay, and then one by one, and I'm going to show you how to. There, once we finish the chapter, then we have to do the practical practice questions also. So that's why this number 17. Today's date. If we go to dashboard, when we do history and physical, there are questions. So you need to practice. The correct answers are given over there too. You know, so practice these questions. Identifying risk factors for patients' sleep disorder. Identifying risk factor of sleep disorder. Example, which of the following is a major risk factor for obstructive sleep apnea? Okay, I know like these are like sometimes it doesn't make sense, but I want you to practice, okay? Because when we
Is this from domain one?
sorry, say again.
Is this from domain one?
Domain 1, yes. We are in domain 1 right now.
Yeah, I have a little domain.
You have different?
I don't have four domain. I'm used to do.
Okay. Let me see. You have a little bit different? Is there documents? History and physical?
See, I have a little.
Oh, okay. Okay. Okay, I'll fix that. Maybe I have to publish. So, hold on. Let me see. So you have verification and history and physical also. Do you,
Yeah, I got domain one information, clinician order,
yeah, verification and clinician's order and physical and medical, right? History and physical.
yeah, physical, B,